we're going to talk about how your water breaks. So there's a couple of different ways that your water can break when you're in labor or before labor, and what to look for and what your provider will probably suggest. So the first way is, the acronym is PROM, which is either pre-labor or premature rupture of membranes. So when that happens, your water will break, you will not be in labor. So if you're 37 weeks gestation or above, chances of you starting labor will happen probably shortly after. Usually anywhere between 12 and 48 hours, a woman will go into labor afterwards. So the biggest thing is to make sure that you call your provider, whether it be an OB or a midwife, let them know that your water has broken, and they will give you the proper steps of what to take. Usually they will tell you just to kind of wait until contractions start, and then you're going to head to the hospital if you're going to the hospital, or your midwife will come to you. The risk of that is that you've now opened up the amniotic sac, and that leaves room for bacteria and infection to go in. So if it lasts longer than a certain amount of time, whatever your provider is comfortable with, they're going to want to check you out to make sure that you're not having any signs of any kind of internal infection that can affect you and your baby. So if it's before 37 weeks, anywhere between 34 and 37 weeks gestation, they'll probably have you come in immediately. They're going to want to put you on bed rest and watch you, because sometimes when it's before the final stages of gestation, you can sit there for days with your water broken and not actually go into labor, and contractions won't start yet. So they're going to really want to watch you and make sure that you're not getting any infections. And they're also going to probably give your baby some steroids to make sure that their lungs are developing quickly, if they are able to, or they may put you into labor and induce you, because the chances of having a healthy baby at around between 34 and 37 weeks is greater, rather than sitting there and then having an infection set in. So it's going to be completely up to your provider on what they do in that instance. So you're really going to need to just let them know what's happening, what you're feeling, and all of that, so they can make the right decisions for you and your baby. The second way your water can break is through SROM, which is spontaneous rupture of membranes. During this time, you will be in labor. So whether it be in early stages, middle, or the ending stages of labor, your water will just break while you're having contractions. This occurs because your baby's obviously moving down into your pelvis. It's putting more pressure on the amniotic sac, and it's going to burst. It can burst as a gush, it can burst as a trickle, but you're definitely going to feel it, and you're going to feel the baby move farther down into your pelvis. And the contractions at that time are going to get harder, and probably they're going to feel stronger, more intense, and probably closer together. It just means that your baby is getting really close to being born, and it's no need to be concerned, because chances are you'll probably either be in the hospital setting, or if you're birthing at home or birth center, you'll be there with your midwife or your doctor, and you'll be kind of already set up and prepared to give birth. The last way is AROM, which is artificial rupture of membranes. This happens with doctor's assistants. So they're going to use a long hook, kind of looks like a crochet hook, if you know what that looks like. It's long and skinny, has a little curl on the end, and they're going to stick it up through the vagina and pull the sac down, and it breaks it open. Sometimes this is, again, a big gush, or it'll just break it enough to trickle. They do this for a couple reasons. One can be that you're already getting induced, and it can help speed the contractions up, or it can be used to actually induce your labor by itself. So either way, kind of up to your provider why they're doing it, but again, it is up to you as the patient to say yes or no, you want this done. It will also make your contractions be harder and stronger, and make the baby move down into the pelvis faster. So just talk to your provider about the options and what can happen if your water does break.